Hi, my name is Tasha, and I will be performing the drawing up insulin skill video today. To begin, you do want to make sure that you verify the orders from the provider. You are going to want to verify the 6 rights of medication, which is going to be the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. You will want to check and verify the order in the EHR. We will be giving 4 units of regular insulin and 8 units of intermediate insulin for a total of 12 units subcutaneously prior to breakfast. You are going to want to enter the patient's room, close the door behind you to provide patient privacy. I would introduce myself to the patient, and then I would ask them their first and last name and their date of birth and verify that on their wristband. I would ask the patient if they have any allergies to medications, which could include any foods or seasonal allergies as well. Prior to giving any medications, I would check their blood glucose levels and let them know when their next meal will be arriving. I would let the patient know that they are going to be receiving insulin medications subcutaneously per the provider's orders. They will be receiving this medication every morning before breakfast, so that's what I would let them know. At this point, I would let them know what the medication is used for. This is going to be used to control your blood sugar. This helps to move the sugar from the blood into other body tissues, and from there it is going to be used for energy. It is also used to stop the liver from producing more sugar. I will then let the patient know that they might feel a slight burning or stinging sensation while the injection is being administered, which is normal and should subside shortly after. I will inform the patient of any side effects. Some of these could include redness, itching at the injection site. They might have some bleeding or any bruising. I would also let them know about the adverse effects, which could be shortness of breath. They would have some dizziness. They could have hypoglycemia. So I would let the patient know that if at any time they experience any confusion or feel disoriented or have any excessive thirst, any of those symptoms, to let me know immediately. I will then ask my patient if they have any questions. At this time, I'm going to perform hand hygiene. I'm going to be verifying the orders in the MAR and calculate the total number of insulin. I will make sure that it is 4 units of regular short-acting insulin and 8 units of the intermediate insulin for a total of 12 units. I will check the labels and expiration dates, and then I would have another nurse verify those as well. Now I will perform hand hygiene and apply my clean gloves. You're going to want to roll both of your medication vials between your hands to mix the medications. And then you're going to want to wipe off each one with a clean alcohol wipe on the top. You're going to want to grab your insulin syringe with the cap on. Verify again in the EHR the amount of medication that's going to be used, which is the NPH of 8 units. So you want to draw up the 8 units of air. You'll want to remove the cap and carefully place the needle inside, insert the air, making sure that you do not touch the solution to the needle. At this point, you're going to verify in the EHR again for the short-acting regular insulin, how many units you're going to be drawing up, which is going to be 4. So you will draw up your 4 units of air. And now you will carefully insert the air into the regular short-acting insulin bottle. You will invert the bottle, and now you will draw up your 4 units of medication. You also want to be sure to remove any air bubbles and pull up on the plunger. Sorry, push up on the plunger and making sure that there's no air bubbles in there. So at this point, you have your regular short-acting insulin. You do want to confirm again the dose of the intermediate acting insulin, or NPH, by comparing once again to the HR, which is 8 units. So at this time, you're going to determine the point. I always like to look and say, okay, I'm going to do the 12 units, and which is the combined of them both. So you add them, the 8 plus the 4, so you'll want the 12. So you're going to want to carefully insert your needle into the NPH, which is the short-acting insulin as well. You're going to want to make sure that you do not aspirate the medication into the vial. You'll want to invert at that time. And at this time, you're going to withdraw the remaining 8 units of medication, making sure that you do not overdraw. Okay, which is the desired amount. If you can see the amount here. All right, so you just want to, recheck that you have your 12 units, which we do here. If your insulin is prepared away from the patient's bedside, you do want to label the syringe with the name, dose, and date, and your initials. If you are doing it away, you'll want to recap the needle using the one-hand swooping technique. Never recap a needle without that. Once you're done, you will engage the safety device, and then you're going to want to discard your needle into the sharps container. You will ask the patient if they have any questions or if they need anything. You'll want to make sure that your patient is comfortable. I will clean up my mess. I'm going to be removing my gloves. I will perform hand hygiene, and then I will document everything that we did with the medications. Thank you.